Hi, everybody. My name's Simon Marmura Brown. I'm the Strategic Director of Research and Knowledge Mobilization with the Pond-Deshpande Center, and I just want to welcome everybody to what we're calling Building Healthy Futures, Collaborative Solutions for Health and Housing Resilience, which is, of course, our showcase on the 100-day Rapid Innovation Challenge, which we launched in the summer of 2024 to address challenges Moncton was and is facing around housing and homelessness. Um, Before launching into the showcase and sharing with you the project, I want to respectfully acknowledge that the University of New Brunswick, which is where I am, is on the unsurrendered and unceded traditional lands of the Wolastoqiyik peoples, and that beginning in 1725, the Peace and Friendship Treaties established Wolastoqiyik title over these lands and provided rules for ongoing relations between nations. We are all treaty people. I also want to acknowledge that this project took place in Moncton, and Moncton is also on the traditional and unceded territory of the Mi'kmaq people. And this territory was also covered by the Peace and Friendship Treaties, which Mi'kmaq, Wolastoqiyik, and Passamaquoddy people signed in 1726. We want to recognize the responsibility we have to hold this place in a spirit of peace, friendship, ongoing reciprocity, and of course, reconciliation. We're here today to showcase the 100-day Rapid Innovation Challenge, which again was launched last June to address those challenges the city of Moncton was facing around housing and homelessness. I'm really happy to be joined today by two other co-presenters. It's nice to have company. I want to introduce Elizabeth Pavlovic and Dr. Ali McGill. Elizabeth is a nurse practitioner and a teaching professor at the University of New Brunswick. She's also completing her PhD with UNB's Health Systems Lab. Dr. McGill is an assistant professor in the Faculty of Nursing, also at the University of New Brunswick, which she joined after a 21-year career as a registered nurse and a nurse practitioner. So the three of us are going to co-deliver this showcase. Briefly, Beth is going to frame the project and give us some background information on what is happening in Moncton, which of course is a reflection of what's happening across the province. I'm going to talk about understanding and addressing complex challenges and the methodology that we at the Pond-Deshpande Center employ to do so, to address complex challenges. And then Dr. McGill is going to talk about her experience as a participant in that process, the outcomes of it, and sort of where we are today. And afterwards, there will be some time for folks to ask any questions they might have. So please keep that in mind as we're showcasing this project. I need to change my slide here. Before we do so, I just want to acknowledge the wonderful funders and partners we had for this project, without which it wouldn't have been possible. I'd like to acknowledge first the City of Moncton, who was our primary funder, but also the Northpine Foundation and the UNB Faculty of Nursing. Without their support, projects like these wouldn't be possible. So thank you to all of them. And now, without further ado, I will pass the mic, so to speak, over to Beth.
Thank you, Simon. I appreciate the introduction. So as Simon mentioned, I am working here at the Faculty of Nursing on the Moncton campus. And so for those of you who may be a bit unfamiliar, our Faculty of Nursing has thanks for spotlighting me. Wow, that's incredible. Our Faculty of Nursing campus has a satellite campus here in Moncton. And so roughly every year we have 100 students within our campus here at the Moncton location. And what ends up happening is our students are pursuing Bachelor of Nursing degrees, and they are an accelerated program. So our program runs throughout the entire year. We get a few weeks off during the month of August, but our students are working tirelessly all year round to have rich clinical placements and working with community partners in order to achieve their education. A bit about me as it relates to my teaching at UNB. When I started teaching at UNB back in 2023, I was really passionate, and I've always been passionate about working with individuals in mental health crisis and housing precarity and improving primary care access overall. So It's a really incredible blend and marriage of teaching students about some of these things and then being able to collaborate with some community partners like Pond-Deshpande and some of our community partners here in Moncton that I've been so fortunate to work with. So a bit about, if you want to change the slides,
Mhm. Sorry.
a context
Great.
here in Moncton, we are a bit uniquely situated in such that we have bilingual health authorities. So we have Vitalité and then we have Horizon Health Network, which both provide services to the population here in Moncton. And a lot of our shelter services, a lot of our housing services are also bilingual in nature. The context here in Moncton as of October 2025 was the last time that the Human Development Council reported on Moncton homelessness. But in Moncton alone, in October of 2025, there were 827 individuals, total unique individuals experiencing homelessness for at least one day of the month. In that same month, October of 2025, there were 570 total individuals reported to be experiencing chronic homelessness for at least one day of the month. And so chronic homelessness is defined as individuals who are homeless, who have either a total of at least 6 months, so 180 days of homelessness over the past year, or recurring experiences of homelessness over the past 3 years, so a cumulative duration of at least 18 months. So chronic homelessness, unfortunately, we're seeing the highest number of the chronically homeless individuals reported in Moncton for as far back as I could review the reports that the Human Development Council has reported. So 570 chronic homeless individuals is the highest that we've seen, and that has been steadily increasing since the COVID-19 pandemic. So essentially, the data tells us that the number of people experiencing homelessness is increasing, and we're seeing that, right? We're seeing that daily here in Moncton. More visible homeless, more people who are in need of services, clinicians who are strapped, service workers who are seeing more and more people who are in need of services in the domains of housing and healthcare. In response to this, in 2023, when I started here at UNB, I worked closely with the Canada's Mortgage and Housing Corporation, so CMHC. And we hosted a sense making and ideation workshop, and this was called Shelter in the Storm, Pathways to Generationally Secure Housing. And what these kind of workshops and what this lab sort of contributed were, we brought together a bunch of stakeholders amongst kind of community partners and worked together within these labs or these working groups and collaboratively identified challenges within the community. And we identified as well really big solutions. So we dreamt really big. We created these incredible possibilities. And we also included the lived experiences of people who had either experienced homelessness or who were homeless at the time of the lab. The ultimate intent of the kind of the lab itself was to develop a deeper understanding of these complexities, especially within some of the already overburdened support systems. So some of the housing corporations, some of the shelters, how can we divert resources from people who are overburdened, and how can we create different or unique solutions? So the solutions lab was guided essentially by two questions. Which factors can be identified and addressed together in order to favor housing solutions which are stable, secure, and affordable for generations to come? And secondly, which qualities will these solutions require to ensure they can connect equitably and accessibly with those in need of timely and intensive wraparound support? So wraparound supports including social, health, life skills, education, all of those kind of wraparound supports. And a lot of insights emerged within this lab. It was really, really enlightening. People who are precariously housed need to feel safe and a sense of belonging. And there needs to be programs and supports that work for them, not against them. And our current supportive housing programs with rent subsidies and all of those components as it relates to landlords and willingness, they are difficult to navigate. And particularly for those without a fixed address or without reliable income. A lot of barriers were unfortunately identified within the working lab and within our groups, but we also came up with so many great solutions. So combating some of those wicked problems that we're identifying. So We know that there are a lot of great solutions here in Moncton. We're committed to working with partners across sectors, health, Horizon Health, Vitalité, Université de Moncton, UNB. We have great committed partners as well as shelters, Harvest House, House of Nazareth, to name a few, who want to collaborate and make a difference. We have several innovative pilots and projects that are implemented within our community. So the Salvis mobile van that are doing outreach, for example, to shelters. We have Housing First initiatives. We have Human Development Council working really, really tirelessly. And that's just naming a few. We have strong momentum going right now through the City of Moncton, as well as our government, our provincial government, really enabling us to create some of these key pathways for change now and not later. We do know that what isn't necessarily working is that our services in Moncton are very siloed, and it's difficult to kind of understand why that's happening. Is it because of bilingualism that is required to be offered in our services? Is it because of people being proprietary about the populations they serve? Like I get that. I want my people, my populations to be very well cared for. And is that some of that, reluctancy to collaborate because of a sense of ownership and so much care that is underlying some of these services and systems that people are delivering. I think at the core of what's not working is some of our systems are not designed for the challenges that we're facing. It's not an individual provider or service level problem. We have inefficiencies and duplications across our siloed services and systems where one organization is doing one thing and we're not communicating with other organizations about what's actually happening. And finally, I think our change is occurring too slowly. I mean, myself alone, I've been talking about some of these things since the COVID pandemic and pre-COVID pandemic. We were starting to see some of these concerns, and we're here now 5 years later without any clear path forward. And so I think we're getting there. We're getting to a clear path forward. But I think what is ultimately happening is we are not keeping up with the pace of individuals who are experiencing homelessness and those who are chronically unhoused. So, what we know is that systems need solutions that can be tested quickly and adapted in real time. And so, essentially, that is where the idea for the Rapid Innovation Challenge comes from. This allows us to move from talking about problems to actually experimenting with these actionable, testable interventions.
Thank you so much, Beth. I'll pick it up from there and talk a little bit about Rapid Innovation Challenge and the sort of the methodology and the process through which we worked to address some of those challenges that Beth has just outlined. Um, we talk a lot and think a lot about complexity. And when I say a complex challenge, I say it with purpose. It's a complex challenge because it involves multiple intersecting systems, which Beth just identified as some of them. But the healthcare system, the justice system, various levels and layers of social services, as well as different layers of government. And none of us here can snap our fingers and make services appear. None of us can dictate federal, provincial, and municipal policy. So what do we do? Um, what we can do is work to find innovative solutions to aspects of what is, again, a very complex challenge. And so what I'm going to do is explain how we at the PDC, the Pond-Deshpande Center, practice social innovation, how we think about complex systems, and the process through which we worked to create change for that community, which is, of course, our community as well. So under the conditions that Beth identified, the PDC was brought in to conduct what's called a Rapid Innovation Challenge. A Rapid Innovation Challenge is a 100-day, fast-paced process that brings stakeholders together who wouldn't normally share a table. So this is government, researchers, community partners, people with lived experience, to explore problems and to co-develop solutions. Fundamentally, what we try to do is to bring people together to tackle complex challenges. And this is a proven methodology that brings people together to define and analyze a problem, to develop solutions, and then to test those solutions. And hopefully, if they work, to scale them. The model has three phases, and I'm going to just touch on these three phases throughout my portion of this presentation. But the three phases are discovery, implementation, and sustaining. So in the discovery phase, we research the problem and define it. In the implementation phase, we co-develop prototypes. And in the sustaining phase, we test them. And again, if they're successful, we scale them. So with this project during the discovery phase, we conducted interviews with healthcare workers and homelessness response sector workers, and we worked with the University of New Brunswick nursing faculty students who were investigating working conditions of frontline workers. We established a leadership council, which was made up of city representatives, researchers, folks from community organizations and government agencies to clearly define and identify the problem. During the implementation phase, we brought people together to collaborate and co-design prototypes to address the problem and the challenge areas we had defined in the discovery phase. And this is where, over the course of 100 days, three groups met to deliberate and discuss thematic problems and co-design solutions together. And the sustaining phase, which is where we are today, we're thinking about how we implement those prototypes, how we sustain them, and how we scale them if they're successful. But the idea behind all of this, and I think Beth underscored really well how urgent the challenge was and how slow moving sometimes things can be. The purpose is to move from insight to action really quickly and to deliver feasible, viable, and testable solutions that are ready for implementation. I'm going to talk a little bit more about the discovery phase because I think it's really important. Um, how we understand challenges and problems is vital because it determines how we scope, how we focus, and how we frame the conditions through which we have the conversations to develop those solutions. So during this phase, our focus narrowed towards the transition towards housing and working to ensure that those people stay housed. And during the discovery phase, we develop what's called a theory of change. And this is sort of a statement to guide us from point A to point B. And our guiding theory of change for this project was if recently housed individuals in Moncton can easily access the services and the care they need, their urgent and diverse needs can be meaningfully addressed, enabling them to focus on their long-term well-being and be better equipped to maintain stable housing, which reduces inflow back into homelessness and brings us closer to eliminating homelessness in the Moncton area. Our theory of change informs how we structured the teams and the project, and our understanding of complex problems like the one we faced, I think requires clarity, like thoughtfulness, depth, and rigor. We use what's called an iceberg model to help us understand complexity by looking beneath the surface of what are visible problems and uncovering barriers or challenges which are often invisible. At the top, we see things like events. These are the things we see every day. It might be people. It may be encampments. It might be visible addictions. Below, we have things like patterns. We see trends. Beth mentioned these reports that have come out that identify and showcase the population of homeless people increasing. We see with that other trends like the rising cost of housing, of food, a lack of affordable housing. We see patterns. When we move deeper, we see structures. These are systems, these are policies, these are processes that drive those patterns. For example, we know that we have a healthcare system which is overburdened, where people are burnt out, and which therefore struggles to provide the kind of wraparound care that this vulnerable population really requires. And then finally, at the bottom, we have mental models. These are the values, the beliefs, the assumptions that hold the system in place and undergird it. And we've all heard of these assumptions, these stigmas. These people are lazy, they're addicts, they're criminals. We believe that if we want real change, we have to think about these deeper levels and even work within them to shift structures, to shift mental models, and to not just react, which we often do, react to the top, to the things that we can see. When we applied this theory to housing and to homelessness, we're able to see the whole system a little bit more clearly. So at the surface, and I mentioned some of these, we see a new encampment. We hear maybe complaints from businesses. We see a lack of affordable housing. Underneath, we see those studies and those surveys, those reports by the Human Development Council, studies like the At Home Chez Nous project. We see rising housing costs and a lack of services. And then we look at the structures. And I think Beth also mentioned this. It's a systemic issue. And the reason why it's important to think of it in that way is because only when we look at those sorts of disconnections between overlapping systems, between the healthcare system, the justice system, social services, which are provided across different systems, and we identify those sort of relationships between them, can we really begin, I think, to address what is a complex systemic challenge. And finally, at the base, we have our mental models, and we heard all sorts of, we learned about the stigmatization around homelessness, but also stigmatization around mental health and around addictions. All of this work and the way that we think about complex challenges leads us to a sort of anchoring and guiding question. For this project, that question was, how might we address the diverse and urgent needs of individuals transitioning from homelessness to ensure their long-term well-being and the sustainability of their housing situation? We use this question to guide us throughout the process, throughout the 100 days, every idea, every conversation, every prototype, we hope and we try to connect it back to that question. Now, again, too often we react to symptoms, that tip of the iceberg. We move an encampment, maybe. We've moved people around the city. And our challenge was to help frontline workers, government, community organizations design better structures and challenge their mental models to think about long-term system readiness and not just those short-term band-aid solutions, which I think far too often are deployed around this particular issue. Um, to do so, we designed or identified three focus areas and created three teams dedicated to each area. So first we had a team which focused on stigma and on breaking down the stigmas surrounding homelessness in order to foster a more inclusive community. We had a workforce team which focused on developing support for the workers who engage with, interact with, and support that population. And they worked to provide and develop holistic support teams to keep precariously housed people housed. Finally, we had a team that focused on patient-centered policies, and that is focusing on flexible policies to ensure that we're accommodating the wide range of needs that this population has and requires. Each of these teams, and I think Ali's going to talk a little bit about being a part of one of these teams, but each of these teams consisted of policymakers, researchers, frontline workers, community organizers, and I think most importantly, people with lived experience. And these groups were guided over that 100 days to discuss and deliberate on their topic area and design a prototype to address it. I won't speak for much longer, but I will just briefly, I think, summarize and add a little bit more information to the process. Again, the discovery phase, we work with systems leaders, we conducted interviews, we do research, we work with systems leaders to define the problem, to create the how might we statement. And this phase is guided by how we understand change and understand complexity, which in turn shapes how we define the problem. During the implementation phase, we brought together 35 stakeholders from government, from community organizations, from frontline workers, researchers, and people with lived experiences to sit down over the course of 100 days in facilitated meetings and collaborate and create solutions to those problem areas. We start the 100 days with a launch workshop where we bring people together, we explore the problem, we identify our theory of change, we discuss complexity, we identify the challenge area, and we create those teams. About midway through at day 50, we host a midpoint review to check progress, to refine ideas, to connect any prototypes that might be overlapping, and just discuss sort of where we are. And then by day 100, we hold a sustainability workshop where each team presents the work that they've been doing, the insight that they've gained, and the prototype which they have developed, which again is a small practical, sort of built for real world testing solution. And again, our goal today is, of course, to share these outcomes, to celebrate, I think, the partnerships that made them possible, and to identify how we can sustain this momentum. I will pass it over to Dr. McGill to talk about the process from a participant perspective. She was a participant throughout this process, and so she has really in-depth knowledge about the process itself, what it felt like, what it was like, and also to talk about the three prototypes, how they're moving forward, and where we are today. So over to you.
Great. Thank you very much, Simon. Good morning, everybody. I'm really happy to be here to be able to talk about this experience as a participant in the 100-day challenge. It was very fast moving, even though like the whole 100 days and getting together. Simon had mentioned the participants. As somebody who has worked with individuals who are trying to navigate an incredibly challenging health, social, and healthcare or health, social, and housing system for over 21 years, it was really wonderful to be able to sit with individuals from the housing sector, from municipalities, from the provincial government, social workers, shelter workers, and people with lived experience. So it was, you're taking care of somebody, you write them a prescription for a medication, they don't have access to social assistance in order to get the card to cover their health care. And you're sitting next to the person who does that work, who helps people get their identification that they need. These are the connections that we were able to establish within the 100 days, like getting to meet the people that work in the system that you don't get to connect with very often. So this experience it was fast moving. We worked in short cycles. We're generating, testing, and refining ideas. It was really humbling. So I just said, like, we're constantly confronted with the real complexity and fragmentation that the system is, that we're all experiencing in terms of the system. Many health, housing, social care providers shared the challenges they face every day and how hard they're working every day to try and make a difference. And it was also really energizing. This is one of the first times, again, like we all were able to get together as collaborators within the system and intentionally have the opportunity to try to help this problem, like focus on this problem and do it together rather than individually. So we had a lot of people in the room with all the right intentions, and hearing about their work was really inspiring. So there was a sense of urgency and shared purpose, but also recognition that no single organization or person can solve this alone. We've heard that from Beth already. We need a better understanding of what one another's work entailed to better help those in need. We'll move forward to the next slide. Just want to talk about what was the process like. The days were highly structured, focused on rapid learning, and I'll just give you a few examples of some of the work that we were able to accomplish. This was very important, anchoring in a persona or a real case. So what we were able to do, it ensured we were grounding our work in lived reality, not like abstract systems thinking concepts. All of our groups were each given the opportunity to develop a persona of an individual trying to get from homelessness to housing. So we were mapping using sticky notes. We had our facilitators helping us with virtual whiteboards and trying to trace the paths that people take through healthcare, shelters, justice, mental health, and social services. We were able, through this process, kind of identifying gaps and friction points that we were identifying. And each group was able to illuminate this for the entire 35 of us that were in the room. So we were learning about places where people fall through the cracks, where information doesn't flow very well, where workers are forced to use kind of these Band-Aid or duct tape solutions. And in systems thinking research, we call these workarounds. We realized by doing this and having this opportunity that none of us in any group with all the knowledge and experience, we couldn't figure out how somebody gets from homelessness to housing and having that sustainability. We had that rapid prototyping opportunities where we're having the time to explore potential testable ideas. Rather than designing these large idealized plans, it was like, what can we do now? What can we get started? And then we had this another wonderful opportunity to get feedback on our work from our lived experience advisory table. So these were people with lived experiences of homelessness. They provided us honest, direct input that really shaped the direction of our work. It was really meaningful for each of us, each of our groups. We really valued this opportunity. The whole process itself was very collaborative. It's also really challenging. And then that's exactly what we should expect when we're up against wicked problems and complexity. I'll talk now about the three teams and their outcomes. By the end of the challenge, each team produced a prototype. We had team one who produced the stigma prototype, and they co-created a video featuring lived experience storytelling. It was incredibly moving to watch, and for a lot of the workers in the room, it really spoke to our everyday experience of interacting with individuals who are struggling to stay safely housed. Early evaluation of this prototype with nursing students showed some real positive shifts in empathy. So when we think about changing mental models, this is important in terms of stigma, getting the community understanding how people are experiencing homelessness, and that it's often a paycheck away. And it's not, we have to move away from these stigmas that they associate with housing or with homelessness and get to know the people that are experiencing it better. So this was a wonderful prototype that this group produced. The advisory table, they were there. They were able to give us some advice on ethical storytelling and participants owning their stories, and that was really meaningful feedback. The second group, I'm going to speak at length at the end of this presentation about, but we were the workforce prototype group. We really looked at the personas, like we really took that personas activity and then started to think, how does somebody map this journey from first contact to stable housing, and what's that like for the workforce? How are we interacting with our clients? What are we doing to support them? And how challenging is this process? Again, we're having that really challenging time identifying a viable path through the system. And we were coming back to severe fragmentation is what the group came back to. And how do we improve that? So this became the foundation for a more comprehensive mapping project, which would actually map and model the entire health, housing, social justice system within the Moncton community, and to identify what are the work activities of each system actor. So each worker in the system, how do we do the work with the population that we're caring for, and to be able to see how the work is connected amongst the different workers in the system. So that was the workforce prototype there. And what would come from that is something called the MAP, which is Moncton Area Pathways to Housing, and really identifying through the workers, what do you actually do? How do we connect with you as another worker in the system? What is your contact information? What are the forms that my clients need to fill out or I need to assist them with to be able to do this? And just creating this really collaborative data access point for those working in the system to work more collaboratively together. So getting away from that siloed system. And then we have the team three, which is the patient-centered policy prototype. And this was an excellent prototype where they looked at and they want to look at and examine policies and how they actually fit with how people access the system. And they did a wonderful job presenting this. They identified how policies are mismatched, where there's duplication, as well as real heavy reliance on ad hoc crisis responses instead of preventative opportunities. And it really reinforced the need to include voices, so patient client voices in policy redesign. So together, these prototypes revealed one real core issue, and it's that Moncton needs stronger, more intentional mechanisms for collaboration across systems. And we'll move forward to slide 17. I'm going to focus, I know we spoke about the three prototypes. What's happening next is what the next part of the project would be. I think we lost our our presentation. I'm going to keep talking. There's now some coordinated next steps. In terms of the workforce prototype, what we'll have first is a mapping project conducted by baccalaureate nursing students at the University of New Brunswick Moncton site. So as part of their coursework, third year BN students will identify the key workers and collaborators across health, housing, mental health, substance use, social services, and community organizations. So they're going to map where are people entering the system. So what are the inputs when we think about systems design research? How are people entering the system? And then what are the conditions that need to be in place in order for individuals to access services? So those are what we call preconditions or resources. And then they're going to also ask questions and identify what policies and practices are in place across the different sectors. And then we want to know what are the outcomes of the activities of work of all the workers in the system. So they're going to be doing some real in-depth interviewing to identify who are the workers, who are the actors in the system, how are they connected to one another. So then we can have a map of the entire ecosystem of the health, housing, social services, and supports in the Moncton region for people experiencing homelessness. So this work that the students will be doing will be initiated in January, and it really forms the baseline, like an environmental scan, for a broader research project. So in the fall of 2026, the UNB Health Systems Lab, which is a lab that I'm a director for, we use a systems engineering methodology called the functional resonance analysis method. The method aims to map and model complex ecosystems. So the ecosystem that we're talking about is health and homelessness and social supports in Moncton. And it's really aimed to identify all the actors in the system, how they interact, but then we gain additional information about, in terms of everyday work, where are the challenges existing in the system? Where are the opportunities existing in the system? And how do we move a siloed, fragmented system towards integrated care and service delivery? So what we'll be doing is the second phase of the mapping and modeling project done by the Health Systems Lab will give us an enhanced understanding of how work is conducted every day by frontline providers. We're going to know and gather real world insight into how the current system actually functions day to day. What are the informal workarounds that workers are conducting every day to support their clients and patients? Where are the pain points in the systems? And where are the opportunities to move towards a more integrated model of care? So we'll have a visual map of health, housing, and social support ecosystem for people experiencing homelessness. And the goal will be to produce multi-level recommendations that move fragmented care towards integrated care. If we move toward slide 18, I'm going to show you how this approach has had success with other equity-deserving populations. So the next slide, 18, is a map of the settlement and health services for refugees and asylum seekers in Fredericton, New Brunswick. I'll speak about the model while we're trying to get it up on the screen. So the next slide, once it's uploaded there for you, it's going to show you work activities and functions that exist within the system in Fredericton. So the systems thinking research that I conduct, again, I mentioned it previously, was the functional resonance analysis method. It's a mapping and modeling approach used to map complex systems. It's informed by data collected in focus groups, interviews, workshops with health and settlement workers in Fredericton to provide care and service to newcomers. So the model is built using specialized software. It demonstrates all the function of work completed by these workers in the system. It also demonstrates how the functions of work are connected and dependent to one another. When we interviewed all these workers in the system, we asked about their everyday work. How does it vary? What are the challenges and successes that you're experiencing in the system? And we call that variability. How does it emerge and propagate? So how does it come together and cause some challenges or negative outcomes or even positive outcomes? Recommendations are then developed to dampen any of that negative variability and enhance positive variability. The modeling provides us with a roadmap to understand the system better related to system challenges and successes. So this prototype, this is developed for us to gain an enhanced understanding of how does this current system in Moncton operate. We've had success with this model in Fredericton. We learned how how health and settlement and primary care and mental health services can work in a coordinated way. We got that data and we redesigned the system. We are now working with a newly redesigned refugee integrated care clinic where we have identified a far better, more efficient, more equity oriented, more trauma informed, more culturally safe care delivery system where workers in health and settlement are engaged in providing services together to the population rather than siloed, fragmented services. So we've had a lot of success with this approach. We'd like to do it again in Moncton. So our BN students will do that early mapping data gathering. We'll also use data gathered previously by the BN students working with Pond-Deshpande. We'll develop a map similar to this, laying out the entire ecosystem for Moncton. And then we'll do an assessment. Where are the challenges? Where are the opportunities? And how can we move away from fragmentation and design a service that works for people? So how can we get people who are experiencing homelessness into housing successfully? And how can we support them best in keeping them housed? And that's our goal. And we need to have an enhanced system understanding prior to developing solutions. So this is how we learn how the system works first, then we learn what solutions can function best. If we rapidly try things out, we may cause challenges in the system elsewhere. We first have to gain the systemic understanding, and that's what this project aims to do. So I'll pass it back to Simon, and then I'm happy to take any questions about what the research project will, any questions about the research project, any questions about what the nursing students will be doing. But the main thing is we only know what will work if we ask the people who deliver the care what they think and how they experience it. And then how the people experience the care, we need that information as well before we can design sustainable solutions.
Thank you so much. Really appreciate it. And I'm so sorry my internet went down right in the middle of your presentation.
That's okay.
I hope it didn't throw you off. But I'm sure what I missed was wonderful. And I just let me thank you again and you as well, Beth. It's so appreciated. It's such an important project, and it's so nice to hear where things are and how things are moving in what I hope is a positive direction for all of the people who really need the support and the care. We've got a few minutes left. I'd love to open it up to everybody. If anybody has questions for any of us, maybe you can use the hand raise function in the chat there, and we'll spotlight you, and you can ask the question, or feel free to type it in the chat box if you'd prefer. Um, if anybody has any questions. And I'm going to stop sharing my screen as well. Yeah, Renee.
Hi, thanks so much for your presentation. Gosh, you've done a lot, and that's so amazing. And I'm really curious. I heard you talk about next steps, and that's fantastic. I'm also wondering if you have some vision for where you think this will go after the next steps and how you see this moving forward.
Great. Thanks, Renee. That's a great question. So, I mean, that's one of the challenges in being thinking about what's going on in other communities and what are they doing and would that work here? That's you have to kind of block that out a bit. It's great. That's great. But we have to have the context of Moncton. We have to know what's going on in Moncton. And then we think about what would work based on the data that we get. So what are the workers telling us? Okay, what are the workers telling us about the challenges? And we talk about barriers and challenges a lot, but we also need to know that this approach identifies what is working well as well. So when we do these focus groups and we learn and workshops to gather data from workers, We hear about things that are going really well. And when we hear that, we're like, how can we enhance that? What more can we do to support that? Ideally, we would love an integrated care clinic where we see nursing students engage with the public who are able to help with primary care, mental health care, supported housing. That would be ideal, but we need to learn exactly what's going on in the Moncton context first, and is that a good fit or not? There's also lots that's going on in Moncton. Beth spoke about them. There's mobile outreach. There's the Salvis Clinic and the work that they do. We have shelters and supported housing organizations that are doing great work. We need to hear about how they're working together. Are there success stories in there that we can enhance? So there's lots of places we could go, and we hear about other communities and what they're doing, but we really do need to design it contextually to Moncton. Yeah.
I think too, Renee, like some of the work within my PhD, the focus is on hospital discharge processes for individuals who are experiencing homelessness. And so that's kind of, there are all of these components, right? We're talking about challenges, but the challenges that are identified within the literature are, so plentiful that it's like, how do we create solutions for all of those things? And it seems small in some capacities, but hopefully designing a system based on mapping and identifying some of these areas for opportunity, and mapping the system in a way that we can fix some of the fragmentation along the way. So I think the way that I see it is obviously, in addition to what Ali said about nursing students and hopefully a student-led clinic, the opportunities are endless, but I think centered around, patients' voices and experiences, and hopefully, enhancing some of the services that are already available.
Thank you both. I don't really have anything to add, but I see a few hands and I see a question in the chat. So why don't we have Andrea? Your hand is up. Feel free.
Thank you so much, Simon, and thank you to everyone else for the information. My question, Ali, is around the mapping, just to better understand. Is it specifically around the healthcare mapping and how it supports? What is the mapping that you're planning on doing?
Thanks for, how are you?
Good. How are you? It's really funny because I have this sticky note up with your email, and I'm like, oh, I got to connect with Ali.
That's a great question. And no, it's not just healthcare. If we only focus on one sector, we will never get there. So we need to know what the shelter organizations are doing. We need to know what the caseworkers in those settings are doing to support people on their journey from homelessness to housing. We need to know what social workers are doing in their everyday work. We need to know what people are doing at social assistance. We need to know what the community committees are doing to support patient or clients as they move from homelessness to housing. So this is our sampling will be really purposive in the fact that we want to know who is everybody, what are all the workers. So when I say workers, I use that term because whoever's in touch and providing care and support to people experiencing homelessness. And these could be community kitchen operators. These could be people who are working on vocational services to help people develop skills for jobs. Like, who are all the actors in the system that can support somebody from this journey? So we can't focus on healthcare. I worked in healthcare for a really long time, and this is getting worse. If we stay in our little mental model of healthcare, this homelessness is not only about healthcare. It's about all the social determinants of health, and we need everybody at the table working together in order for this to happen.
So I guess that being said, however, I am more grounded within my role from when we first met. And all of those players sit around I shouldn't say all, but all of the nonprofit organizations, all the levels of health, and then the different levels of government sit around GMHSC. We have 30 members now. Ability NB is there as well. We have Humanity Project is back with us. So that being said, however, GMHSC can help support the mapping part of that, happy to do that and bring that in if it's presenting the work to the committee to see how that can be supported. And then from all of the different food providers. We actually conducted from a GMHSC level a research project around food security. So I've been able to get in connection with all of them because of that. So however I can help support in getting you connected to them, let me please know.
Wonderful. Thank you. We were talking about you already at a meeting as our first stop to be able to
Perfect. Yeah.
connect with the right people. And that's what we want. Who are the right people doing this work? What is the work that they're doing? How is the work that they're doing connected to one another? And where are they facing challenges or where are things working well? So we need all the voices telling us what they do. And then we'll be able to communicate it better. And we'll be able to inform our clients better as they try and navigate
Mhm.
this very siloed, fragmented system.
Absolutely. Happy to
Yeah.
support.
Thank you.
Thank you so much. I will read, Chris has a question in the chat that I'll read. Will you continue to review the systemic understanding of the model? Is a regular analysis of the success you have had at the downtown clinic in Fredericton an integrated part of the approach?
That's a great question, Chris. And yes, we do have this historical knowledge and practical knowledge, and I still work a day a week as a nurse practitioner caring for people experiencing homelessness out of the downtown clinic. So we know the success of that model. We see that is in itself developing. We're not quite there in Fredericton. We have a lot of people working within the health and housing sector. We're only just starting to really come together. So some of that experience will certainly play into it. But we do need to continuously, as you had asked about, reassess the system as it changes. We can't just put this model up, design something, and then walk away. Because as we know, shelters close or they open or new clinics open or new services are available. So it continuously needs to be updated. So we know what is working to an extent in Fredericton, where the success has been. So we have that knowledge and we have that understanding, but it may not necessarily work in Moncton. And we do need to know what works in Moncton by the people who are working in Moncton. They need to tell us what works and what doesn't. And then if they tell us this is what we need an integrated health and housing clinic, if that's what we're hearing, then those are the recommendations we'll be making. We don't come in and do an assessment and design a system and do it alone. The whole process of this research is co-design. So once we map the system, we show it, we actually go back to the people that informed us and we say, is this an accurate representation of the work that you do and how you're connected to one another? They tell us, no, you need to change that. You need to update that. You need to move that. We do those things. And then we go back and we test it again and we make sure that it's an accurate presentation. Once we analyze where are the pain points in the system, where are the successes in the system, we can make recommendations. We don't make those recommendations again alone. We go back to the group again. These are the recommendations that we've come up with. They're preliminary. Are they practical? Knowing your experience and your knowledge about your community and the work that you do, are they feasible? We want to know that from the people that are doing the work. So those recommendations are co-designed as well. And then we're able to make these recommendations and tier them as micro level, which is clinical or frontline provider facing or worker facing. Meso level, which is organizational and professional level, how the organizations and sectors work together. And then at the macro level, which is that great big environment, policy, government. So we level our recommendations and we identify who's going to be responsible for them. So they're multi-leveled, they're co-designed, and they come from the knowledge and expertise and experiences of the people who do the work and experience the work every day.
Yeah, thank you so much for the question. We've only got a few minutes, so if there are no more hands, maybe I'll just say something very briefly just about the Fredericton Clinic. Before I started working on this project, I really didn't know what kind of services were provided there, and I think that it should be stated just how innovative and wonderful the work that happens there really is. There's been people like Dr. McGill have been working really hard to make sure that UNB nursing students have a core component of their education, which is working in that clinic. It's experiential and it's working with a vulnerable population. So it's providing, wonderful experience to our future healthcare providers, but it's also delivering a service that is so vital and so needed. And I think, I could be wrong, I think it started just people walking around with book bags, with water and and talking to people. And that's sort of how they, and I just, as a Frederictonian, I'm incredibly grateful that exists. And if it is something that other communities would benefit from, of course, Ali spoke really well about, tailoring things to the needs of the communities, and everything is different. But, I hope that that sort of success can be replicated elsewhere. And with that, I will just thank everybody once again for being here. I will thank again our partners and our funders, the City of Moncton, UNB Faculty of Nursing, and the Northpine Foundation. I will direct everybody to our website, Pond-Deshpande where you can find more information on this entire project. You can read the report in both French and English. And with that, I'll just thank my co-presenters or main presenters, perhaps. Thank you all so much. It's been a real pleasure. And thank you everybody for being here. Take care and have a wonderful day.
Bye, everybody. Thank you so much.
Bye. Thank you.